newborn assessment. I'm going to start by checking the color of my newborn, which is pink. I'm going to check the skin for any milia, stork bites, or erythema, which I don't see. I'm going to make sure the posture is flexed, the head is proportioned at 1/4 of the length of the newborn, and that the movements are bilateral in the extremities. I am now going to start checking the respiratory rate, and a normal respiratory rate for a newborn is 30 to 60 breaths per minute, and I'm going to count for 1 full minute because breathing can become irregular with periods of apnea. So I'm going to place my hand on the baby's chest and count for 1 full minute. Okay, his respiratory rate was 40 breaths per minute. And some signs you would look for that show respiratory distress would be retractions, cyanosis, flaring of the nares, asymmetrical chest expansion, grunting, and rapid respirations. And I'm now going to listen to his lungs and make sure they're clear. And a baby born via C-section, their breath sounds may sound more wet due to they didn't have squeeze to their vaginal birth through the birth canal, so the fluid was not able to get out of the lungs completely. Next, I'm going to move on to his heart rate, and you can check the heart rate at the brachial pulse site or the femoral pulse site, and a regular heart rate is 120 to 160. So I'm going to use the brachial site, and I'm going to count for 1 minute. Okay, and his heart rate is 140 beats per minute. I could then take a pediatric stethoscope, and you want to use a pediatric stethoscope to eliminate any sounds, and listen to his heart. And a newborn's blood pressure is not routinely taken, but when it is, a normal blood pressure would be 65 to 95 diastolic and 65 to 95 systolic and 30 to 60 diastolic. Okay, I'm going to move to the head. To measure the circumference of the head, I would measure right above the eyebrows, and a normal circumference is 32 to 38 centimeters. I would then check suture lines that run the head to see if there's any overlapping. I would then check fontanelles. I'll start with the anterior, which is at the front, and it should be diamond shaped. And the posterior fontanelle, which is in the back, should be triangle shaped. And if there's any bulging of the fontanelles, that could indicate increased intracranial pressure, and any sunken fontanelles could indicate dehydration. Next, I would check for any Cupid's succedaneum, which is swelling at the crown, which happens when a baby passes through the birth canal, and that would decrease in 1 to 3 days. I would then check for any cephalohematoma, which is some bleeding at the bone that does not cross suture lines. Okay. Next, I want to move on to eyes. I would note the color of the baby's eyes, which his are blue. I would use my pen light and check reaction, and his pupils are pearl up. And then going to move on to the ears, which the top of the ears, the pinna, should align with the cathets of the eyes, or slightly above. And any skin tags could indicate retinal malformation. I'm next going to move down to the nose. I want to check for patency of the nostrils by closing one nostril at a time and make sure he continues to breathe, because they are mouth breathers. Okay, nostrils are good. I'm going to check the mouth. I will look for a rooting reflex, which can indicate a cue for hunger. I am then going to look for any injuries, make sure everything is symmetrical. Look for Epstein pearls, which are cysts to the mouth. I will look for any circumoral cyanosis, which should decrease with crying, because that's letting oxygen in. If it increases with crying, then there's a cardiovascular problem. I'm going to check the neck and the thorax now. Make sure the trachea is nicely aligned in the center. The neck should be thick with some skin folds and short. Okay. I'm going to check the chest. I'm going to move my fingers over the clavicles to make sure there's no lumps, which could indicate fracture. Chest should be cylindrical. And then I will check the nipples for any swelling. I'll do measurement of the nipple line, which should be 30 to 36 centimeters. Okay. I'm now going to move to the abdomen. I'm going to listen to bowel sounds first before I palpate. I'm going to listen to each of the quadrants for 1 minute. Okay, bowel sounds are active. I will then palpate, and it is soft and round and symmetrical. Bowel sounds should actually be present within a few hours after birth. I would take a look at his umbilical cord. You may be able to see 2 arteries and a vein. It's bluish in color, bluish white in color when it's new, and it does turn darker as days go by. If there is any bulging at the umbilical site, that could indicate a hernia. I'm next going to check his Moro reflex. So I'm going to lift his arms, and when I drop them down, he should go into a startle position, and the arm should come back close by his body. Okay, so that's normal. I'm going to check hip dysplasia by bending the legs at the knees and rotating, and if I hear any clicking, that would indicate the hip is out of place. Hands, I'm going to check the palmar reflex. I'm going to rub my hand at the palm of his, I'm going to rub my finger at the palm of his hand, and his finger should grasp down on my finger, which is normal. I'm going to check his ankles and his feet. I would check for any club feet, any polydactyl, which is extra digits, and I would check for any webbing of his digits. I'm now going to check the plantar grasp, which I would place my finger right under his toes, and his toes should curve down. Then I'm going to check Babinski by starting at the heel and rub up to his ball of his foot, and the toes should spread. I'm now going to roll him over, check the back. The back should be flat and straight. If there's any, I would look for any tuft of hair. If there's any tuft of hair, that could indicate spina bifida. I'm going to look at the sacrum for any dimpling, which could indicate pilodial cyst or sinus. I will look at the buttocks. I would check the folds of his buttocks to make sure that they are symmetrical. I could check for any Mongolian spots, which are common in African American and Hispanic newborns. On here I can check the anus for any abnormalities. I'm rolling him over, and for a female I will check her labia and vaginal area for any redness, swelling, discharge that could have happened from birth. For males, I would make sure the testes are intact and check for any epispadias and hypospadias, Now that my newborn assessment is complete, I would make sure he's warm and placed back comfortable in his crib.